doctors often like to learn by case studies. Prior to the show, we had an opportunity to meet Julie. She's a young writer from the Washington, D.C. area. Though Julie first sought help when she started noticing symptoms years ago, it took quite a while, seeing different doctors, before narcolepsy was actually diagnosed.
I really love coffee. I love the smell of coffee. I love hearing them grind it. I've always been a big coffee drinker. I come here almost every day to work on my memoir and my blog and stay here almost all day. I started developing sleepiness when I was in college. I was an art history major. I got straight A's. I started to feel that I was getting sleepy. I would get a lot of coffee late at night, 1 in the morning, to try to stay awake to keep studying. I was having a really hard time getting my homework done at night. I was falling asleep at different times in different places. I almost never got through a whole movie. I told myself, I'm just not a morning person. I'm just not a night person. I just had too much coffee, or I didn't have enough coffee. I started having these strange sensations when I'd be laughing about things. When a joke was funny, my knees felt like just as if someone poked behind them, this slight buckling feeling, but it went away so quickly I really didn't know what it was. And then actually it started to happen with more emotions that got progressively worse, so it was more and more noticeable to other people. As soon as I graduated from college, I started having really vivid, I guess they were dreams, where I would wake up in the middle of the night and think that someone was coming into my room to attack me, and I would see the person as if they're completely real. And sometimes I would feel them touch me, and I would try to fight back, but I could never move. I felt like I was strapped into a straitjacket, and I tried to squirm, but I just couldn't react to it, and it was very scary. This is not normal. So that's when I thought maybe I actually have a sleep problem. So I went to a primary care doctor and asked her, I think I have a sleep problem, and there's a strange thing that's happening with my knees, and she thought maybe I was on the verge of fainting. She said, you should try to breathe deeper when you laugh. I just knew that had nothing to do with it, but I didn't really feel like I could tell her she was wrong. At the end of my first year of law school, when it was getting much worse, I went again, and she said, I've never heard of anything like that. I think you could go to a specialist. Maybe you'll find out what it is, but it's probably some sort of a rare thing you're just going to have to get used to. And at this point, I could stumble when I was crossing a street if something annoyed me or I laughed. So the thought of just getting used to it really scared me because it was getting serious. It was actually a sports medicine doctor who was looking at my knees for tendinitis because I was a runner. And I said, oh, there's this strange thing that happens to my knees when I laugh. They buckle. It really has nothing to do with my running. She said, no, tell me about it. So I told her about that, and she thought that she knew what that was. She said, I think it's this thing called cataplexy. And she wrote the word down on a piece of paper and said, you can go home and look it up. So I went home and I Googled cataplexy, and it was exactly what was happening to me. Then I found out that it was associated with narcolepsy, and that these vivid hallucination dreams were another symptom of narcolepsy. So it was like 3 birds in 1 stone. Within a few minutes, I knew this is what I have. I was able to get in with a narcolepsy specialist. I went in for my 24-hour sleep study, and he diagnosed me with narcolepsy, with cataplexy. My symptoms had continued to get worse, so I really knew I needed help at that point. When you tell people, your family, your friends, I have narcolepsy, no one really thinks that much of it, as if I just told them I had the flu or something. It doesn't quite have the ring of, this is a serious, life-changing, chronic disorder. I reached a low point of thinking, this is the worst thing that's ever happened to me. Just hated narcolepsy. I hated it, and I never felt so negative towards something in my life. So I thought, I'm going to beat this somehow. I thought, I'm going to turn this on its head. I'm going to somehow make it the best thing that's ever happened to me. Well, I've always been a runner my whole life. And when I was in high school, I did cross country. I was a varsity athlete in college and always very athletic and competitive. But I always made time for running. I studied a lot of health law when I was in law school because I became fascinated about the issues facing people with disorders like narcolepsy, and decided when I graduated that I really felt our society needed a more truthful story to open people's hearts up to narcolepsy. So I decided to take on writing a memoir about my experience. I have a blog. I've been blogging for 3 years, and so many people from around the world reach out to me and say how much it means to them that I'm writing about the truthful experience of narcolepsy. When I first got narcolepsy, my dreams and my nightmares were so scary that I really felt like I was constantly running from narcolepsy and running from my nightmares. now I truly feel that I'm running towards my dreams coming true.